has worked well along with contact tracing in other places and has helped limit the spread of the disease. But in the US, we have a different situation. First of all, we've gotten started way too late on this. Second of all, there's a massive resistance to testing and contact tracing here. We're having public health officials tell us that people aren't answering their phones, aren't providing the information. Is it realistic to think that even with more testing that we could prevent the spread of the disease? Are people going to do the quarantining and isolation that's required to do that? I mean, we're in a mode right now where COVID fatigue has everybody thinking we need to just get back to normal.
So again, this has been a historic failure of public health policy. And I understand in the United States, it is complicated because of the federal kind of state system. In other countries, it's a lot more straightforward, where you've got a federal government that can mandate policy across different states or provinces. So I totally understand that. And it is very unfortunate that this pandemic has been politicized also. And some of the issues that you're talking about in terms of the resistance to wear a mask or to be tested is really a political issue. So we've had multiple failures of leadership, from the leadership in Washington to the leadership across the different states. And I think that the case just hasn't been clearly made to people that what we need to do is to reduce the super spreaders. We need to identify those with the disease when they're spreading it, and they might be asymptomatic. So it's fairly straightforward to do. We need to make these tests as easy as possible to do. We have not invested in the technology the way that we should have invested in the technology, and the result is a tragic, unnecessary loss of life and loss of well-being and massive carnage in the economy in general. So the case needs to be made by our policy leaders that this is a way that we can substantially mitigate this crisis. The cost is fairly low compared to what we're paying already. And again, and this is like a really good point that Connell made, that people feel really nervous. They're scared when they actually go out. And that affects economic behavior and social behavior. And we can mitigate that by having widespread, like on-demand, once a week tests for everybody. So again, I'm looking for leadership, not just to support people that have been put out of work due to this natural disaster. And that's what this is, right? You're out of work, not because you did a bad job, not because you were fired, it's because of a natural disaster. And we've got a long tradition in the United States of supporting people that have suffered from a natural disaster, not their fault. So I totally get that. But we need to have as the #1 priority the biological threat. This situation is a biological situation, it's obvious, and we need to allocate resources to support the mitigation of the spread of the disease, and we have failed to do that.